Diego County had its first flu death of the season. The Health and Human Services Agency says the man died on December 9th, but the cause of death was only confirmed in just the last few days. Health experts are predicting a harsher flu season compared to last year. There was not many cases at all last year, and a potential strain on healthcare resources because of the spike in the number of COVID-19 cases as well. NBC7's Dave Summers has the latest on what's happening with the flu season.
Nothing quite says flu season like cold and rain. Lately, San Diego has had plenty of both.
Most people understand that even though the flu, of course, is an infection that we're familiar with, we are also aware that it causes a problem every year.
That is the message specialist Dr. Schalch Lepe wants us all to remember as we navigate the next couple of months. Experts predict a more normal flu season compared to last year, and San Diego County statistics are starting to show it. Cases of the flu increased again, with 192 lab-confirmed influenza cases for the week ending Christmas Day. There were 188 flu infections reported the week prior. It's not necessarily something you did or didn't do.
It's just the nature of the virus, and it just so happens this might be a more aggressive variant this time around.
Health and Human Services says a 42-year-old man from north central San Diego County is the first person to die from the flu this season. He was not vaccinated against it and had underlying medical issues. He did not have COVID-19.
So the fact that it's an infection that we're used to, that we know about, that we've had vaccines for many, many years, doesn't mean it's harmless.
The county's cumulative case numbers are significantly higher this flu season. 1,052 so far, just 54 were reported this time last year. The medical community is keeping an eye on rising COVID cases as well. The combination could have a devastating impact on local healthcare resources.
2 or 3 weeks after the cases spike, that's when we start seeing the effect on the emergency rooms and the hospitals.
Like COVID-19, County Deputy Public Health Officer Dr. Cameron Kaiser said in a statement, vaccination is the best defense.
If we know these are safe, effective means of controlling the number of infections, we should trust science and we should do our part to keep this from getting out of control.
If the flu season officially starts in late fall, we're not even halfway through it.
Both diseases are airborne viruses and more transmissible through direct contact. Dr. Schalch Lepe says those measures we used to slow the pandemic, hand washing, masks indoors, and distancing, are just as effective in stopping the spread of the flu. I'm Dave Summers, NBC7.